Well, welcome to Froedtert South. All of you, appreciate you being here this afternoon for this recognition. I'd like to just say a few words about our special guest this afternoon, Congressman Bryan Steil, who is here to do this recognition for one of our nursing staff members. Bryan was first elected to his position in 2018 to serve our state of Wisconsin's first congressional district in the U.S. House of Representatives. And that area spans not only Kenosha County, but also Racine County, the majority of Walworth County, and then portions of Rock and Milwaukee counties. So prior to his time in Congress, he also worked in the manufacturing industry in both Milton, Wisconsin, as well as Beloit. And then he was appointed to serve on the University of Wisconsin Board of Regents for the UW system, overseeing their 26 campuses, the 170,000 students, and a budget of about $6 billion. So he was born and raised in Janesville, Wisconsin, and holds degrees from Georgetown University in Washington, D.C., as well as from our University of Wisconsin-Madison Law School. So join me in welcoming Bryan Steil.
Thank you very much. Can you hear me if I just stand here? Is this good? So the reason we've done this is really just to highlight all the good stuff that's going on. If you turn on your TV, I think you would think that this is a terrible place to live and work sometimes, right? You'd watch the crime, you'd watch all the challenges we have, and we do have those challenges, and we do have to spend a lot of time on them. Somebody was a social worker here along the way. You. And you see some of the most challenging situations that exist in the ER. You see really challenging situations, people that don't want to be there, but they're there either through an accident or something happened. But at the same time that is occurring, right? If you turn on your TV, that's what you're going to see, right? You're going to see a car crash. You're going to see, somebody who's getting arrested by the Kenosha Police Department, right? But you forget that it's actually so many people that are doing the right things for the right reasons. And in particular, in the healthcare space, I think COVID really shined a spotlight on that. That there were men and women waking up every day who had young ones to take care of, were heading out the door to do the right thing, but really to help all of us navigate through it. But it also highlighted that that's occurring all the time. And so we set up an award to recognize a healthcare hero, some kind of an unsung person, right, who doesn't want to be on the spotlight, who isn't going around and proclaiming that they're out there doing the work. But your sister saw our request. Is it Janelle? Yours is Janelle. And wrote an application in support of you. And I thought, in now getting to meet Bryan, your husband, and two of your three little kids, one of it, I'm just going to quote her here. She says, she's gone in at 1 a.m. When needed, and works long shifts when needed. Even though she has 3 children to take care of, she does it all. And you think about the work that our law enforcement officers do, who are also being called upon at crazy hours to come in, off shift, work overtime, uniquely so in Kenosha as we think back to 2020. The challenges we saw in this community where our law enforcement officers stepped up in a really big way. You were stepping up at the same time. And that's not easy when you have little kids. I don't need to tell you that. But that's uniquely challenging. Your mom and dad are here, who I'm guessing pitch in and support as well, so you can do your job. And I just think it's a recognition of all the work that goes in. It's always a team. As I've gotten to know the team at Froedtert, it's a great organization where people kind of come in and pitch in. I got a chance to meet some of your coworkers. One who's been here, you've been a nurse for 40 years. And when you see the longevity of 40 years, you recognize what a great place it is to work, but also the impact that you can have in the community. And so just on behalf of the 1st Congressional District of Wisconsin, we wanted to present you with our Healthcare Hero of the Year. Olivia, come up. And now I'm going to tell you should say something.
I do want to say a few things.
Good.
No. Oh,
Good.
no, are still on them. So.
Yeah.
And I apologize if I go into a coughing fit and my voice is kind of cracked because I'm just getting over something, but I'll try and figure it out. First, I want to thank Congressman Steil for coming to Pleasant Prairie today to present this. I really appreciate you being here and taking time out of your busy schedule. Thank you to my sister Janelle for nominating me. Janelle's a social worker and behavioral health therapist for Racine County and far more deserving of this award than myself. In the ER, we see a lot of crazy things. We see everything from beginning of life to end of life, everything in between. But what we mostly do on a daily basis is just care for people who are not feeling well, having a bad day, and we get to make it a little better. And so for me, that's really the most rewarding part. Not always the crazy trauma and the fun stuff, but just the day-to-day conversations that I get to have with patients, and I learn something new every day, and I feel like I grow in my role as a nurse every day. It's oftentimes a thankless job, understandably, because patients are with us for only a relatively short amount of time. Then they get discharged, transferred, or they move on, and they spend more time with other nursing staffs or floors. And so that's one reason why this award is even more meaningful coming to someone in the ER. I do want to take a minute to say thank you to everyone who doesn't often get recognized, because self-care is not just doctors and nurses. It's not like on TV where the doctors are doing x-rays and giving meds, and there's a lot more involved. And so foremost, I just want to say thank you to the ER techs and secretaries, and they truly do so much for our department, and our hospital could not function without them. To our social workers, thank you for the hours of endless phone calls and coordinating care. Thank you for supporting not only our patients and their families, but also our staff. Thank you to pharmacy and respiratory care. They are the true lifesavers. They play such an important role in patient care, and when they show up to the code, I breathe a sigh of relief because I know things are going to go smoother with them there. Thank you to everyone in diagnostics, lab, and radiology. Without them, we wouldn't even know what was going on with the patients. Thank you, phlebotomists, for getting our heart sticks and all the redraws. X-ray and CT, we keep them busy constantly, orders all day long, ultrasound and MRI as well, and EKG for the constant phone calls requesting them to come to room this and that. Thank you, guest relations, housekeeping, maintenance, biomed, IT, and central supply for keeping our department safe, clean, well-stocked, and operating. And thank you, pastoral care, for all the prayers when we need them the most. And countless others, that's just to name a few. It really is a group effort here. In closing, I just want to say that I'm proud to be a nurse here at Froedtert South. This is a hospital that cares for our community, is involved in our community. This is the hospital that I grew up receiving care, where I lived growing up. This is where my mom retired from after decades of working upstairs in the family practice clinic. And this is the hospital where my family and friends still receive care. So it means a lot for me to be working here. And I'm just appreciative of everyone who contributes to that. It makes my job possible and allows me to care for patients and advocate for them every day, which is always our priority here.
More today, I just want to say thanks for coming out, and I pass it back to you, but really, it's just a chance to say thanks for all the work that all of you do, and your sister for recommending you as our healthcare hero, but so much good work gets done, in particular in the ER, but across the board. There's so many people that come in, and a hospital can be a really scary place for people that don't work in the healthcare space, and it's a lot of you guys who are making that less scary, but also providing an amazing service for our community. So just thanks for everybody, and hopefully everybody has an absolutely Merry Christmas and a Happy New Year as well.
Thank you.